Hello to everyone from one of the medical simulation control rooms at IAVANTE in Granada. IAVANTE is part of the Ministry of Health in Andalusia. Very soon we'll be celebrating 20 years of providing training to healthcare professionals through the methodology of simulation. And throughout those 20 years we've done this with the aim of improving the quality of care, improving patient safety, and improving the psychological care of the professional. Because of this, we're convinced that simulation is the perfect tool for use in the field of healthcare. At this time, IAVANTE, like all other organisations dedicated to simulation, is accepting the challenge and the opportunity that arises with the process of digitalisation in different areas of the healthcare system. We're being confronted by the reality of exciting opportunities such as the metaverse, extended reality, augmented reality and more, which to a greater or lesser extent are already part of the day-to-day training carried out in simulation centres around the world. Events such as the one in which we are currently participating are also of great importance in this particular context. It's the context of being able to share information amongst ourselves, our own community, but also to open up to and welcome anyone who is interested in the topic. We can share what is happening in the world of simulation, what solutions are being developed or considered. This allows us to respond and improve the simulation learning process. I also believe that these types of events make sense insofar as they allow us to do something that greatly interests me. That is, creating an ecosystem in which clinicians can interact with their needs, with the industry and its capacity to generate a response to those needs, and with people who dedicate themselves to simulation. In some way, we can act in a coordinating role, one that is capable of translating a clinician's needs into an opportunity for the technology sector and at the same time ensuring that technology truly understands the clinician's needs. Therefore, it gives me great satisfaction to be here at this moment, at the beginning of this important event, which will deal with issues related to technology, OSC assessment, technology and debriefing, technology and the evaluation of instructors, technology and student assessment, technology and virtual or augmented reality. Many thanks to Coding for this invitation as we introduce the programme of speakers. Thank you.
Good morning. My name is Paloma Rodríguez Gómez, and I have been a nurse at the Fundación Jiménez Díaz Hospital for 29 years. I've worked at the nursing college for 20 years and the director for just over 6 years. I am the director for the nursing college at the Fundación Jiménez Díaz Hospital, and in 2020 we opened another campus at the Villalba Hospital, which I am also in charge of. Our center is linked to the Autonomous University of Madrid. At the Jiménez Díaz campus we have 300 students, while at the Villalba we will have 200 students once the course reaches its 4th year. We teach nursing degrees and postgraduate courses. We have an official master's degree in anesthesia, resuscitation and patient pain care, as well as experts in vascular access, ultrasound guidance and the surgical block. When we started working with simulation, we missed being able to get a full view of our students and the skills that interested us. That is when we got in touch with coding, a move which has definitely been quite strategic. If we want to work on patient safety skills with the students, coding gives us the ability to visualize how many times they wash their hands, for example, during nursing procedures, whether or not they identify patients correctly, whether they are active or passive. All of this helps us to get a good idea of the skills a student possesses. This doesn't have to be done live, but we can review everything easily once the session is over. We are also working on being a paperless school. And coding helps us a lot in this respect, because all our rubrics and checklists are digital. We no longer have anything on paper. That means that our work is faster and much more agile. Having everything recorded in this manner means that we can work on research projects that would otherwise be impossible. Luckily, I have a great team, and thanks to the cohesion of this team, we can all work towards the same common goal: training and graduating the very best nurses in Spain. The team works like a well-oiled machine with Alberto, who is the head of studies and does all the planning, investing many hours alongside Alejandro Martínez, who has pushed hard to improve the simulation process to the level at which we are today. Alejandro has opened thousands of scenarios and areas of study for us. There's also José Abad, who coordinates the digital excellence parts, and Belén González Tejerina and Eva García Carpintero, who lead simulation sessions at the Fundación Jiménez Díaz campus. We're also currently training Fernando Royo to do the same on the Villalba campus. As you can see, nobody works alone. Success always comes with a cohesive team, one that has a common goal and where everyone works for the benefit of the patient. As nurses, this is the reason for being in this profession. Hello, my name is Belén and I am a teacher at the Fundación Jiménez Díaz Nursing College. More specifically, I teach in the area of simulation, and together with another teacher, Eva García, we carry out clinical simulation sessions with students from the first year of their degrees, all the way through to the fourth year when they finish with the OSCE assessments. As a simulation teacher, I can tell you that at the college, coding has been a great help to us. On the one hand, with students, preparing rubrics that I use in the OSCE evaluations that I mentioned previously, but also on the other hand, where it helps us to carry out research. Thanks to video analysis, we can see the entire simulation, analyze it, and create presentations for our studies.
Hello, my name is Alejandro Martínez. I'm a nurse and the teacher in charge of simulation at the Fundación Jiménez Díaz Nursing College in Madrid. Within the changes and progress that have been made at the college is the incorporation of OSCE through the evaluation of skills during simulation. This is where students go through different simulations, different scenarios, and are evaluated using a series of rubrics and checklists. We have to evaluate them, and this is where we saw the need to incorporate the Codeem tool. Codeem has made it easier for us to get rid of the paper-based checklists that we used to use to make calculations and score during evaluations. We are now able to do this much faster and more efficiently when conducting OSCE evaluations. We can evaluate using the different scores and rubrics that we have in any given simulation scenario. This makes the whole process much faster and much easier. We can tag any circumstance at any minute or any second. Any action that has been taken by the student. Then we have the dashboard, which displays all of these tagged actions by minute and second, which we can analyse later in a manner that is extremely easy. We can also add notes and annotations during the scenario itself. All of this allows us to save a lot of time in the latter stages of the analysis. Codeem is a very versatile system which contains a lot of different tools. In addition to the main program, which is installed on a PC, we can also use the Codeem app on an iPad. This allows us to work independently to film, score, evaluate and share data. It has opened up many different options for us. Codim has allowed us to upload our analysis to the cloud. In truth, it is a system which has many different tools and is very versatile. We even use it to analyse behaviour, the behaviour of how we act and how we handle different situations. It's an analysis of human factors and behaviour. To be able to analyse each of these in detail and always get the maximum out of it is very effective. In addition, all this data we're collecting, in many cases, is used in doctoral thesis, which is very interesting. This is a huge amount of data that we're collecting right now, and under these circumstances, Codim makes it much easier for us to handle the data, analyse it and share it. The fact that all this data is connected to relevant video clips is really the basis of the analysis that we're performing.
Hola, buenos días. Yo soy Óscar Martínez Pérez.
Hello, my name is Óscar Martínez Pérez, and I'm a gynecologist at the Puerta de Hierro hospital in Madrid. I'm also a teacher and coordinator of the multi-professional obstetric simulation team at the hospital. In addition, I'm a teacher at the simulation department of the Catholic University of Murcia and a teacher of obstetrics and gynecology at the Catholic University of Valencia. I teach at both degree and postgraduate level, and it's at postgraduate level where I use Codim the most. This activity is based on taking a multi-professional group to wherever we're going to do a course. From obstetric emergency rooms to hospitals, we do a lot of on-site simulation. And it's this on-site simulation where we have to set up camera systems and conduct simulated clinical scenarios in obstetric emergencies. The portability of systems offered by Codim is fundamental because, to put it simply, it can be transported very easily. We're able to film simulated clinical scenarios by digitalising our checklists and putting them into the system. This allows us to do much quicker and efficient debriefings after the simulation has ended. In addition, we utilise the software in the realms of research and course development too. Not only do we conduct courses, but we also design our own. And here, Codim helps us to digitise the solutions that students may come to when doing the activities that we offer. This allows us to modulate our teaching and improve it. We do the debriefing and analyse the points that we need to during teaching. This is typically those points where the student is further away from the correct solution than we anticipated. It's important to note that in an ever-changing simulation environment where in-situ simulation is becoming more and more common, we have to use equipment that is easy to use and easy to transport. Above all, we need technological services which offer close support services. And that's what Codim offers our multidisciplinary team, which includes anesthesiologists, midwives, nurses and obstetricians. Hello, my name is José Alberto Suárez del Arco. I'm an anesthesiologist at Puerta de Hierro Hospital and a member of the multidisciplinary team for the simulation of obstetric emergencies. At Puerta de Hierro, we're dedicated to delivering multiple courses, mainly focusing on obstetrics. But we also have courses on anaesthesia, aimed at people involved in this area in fields such as critical care nursing, auxiliary medicine, and the field of science. These are the areas we work in most, and we deliver courses throughout Spain. But obstetric emergencies and advanced life support are the most common areas. Because we run courses all over Spain, Codim has helped us a lot. We went from having a system of filming which didn't allow us to do more than project images and analyse in a very superficial way during a debriefing, to having a system that integrates many more analysis tools. This analysis process is especially useful during debriefing sessions. As well as the process of filming and analysis, it's probably the portability of the system that has benefited us the most. Previously, we had a system which was more or less fixed. Transporting a system like this was very cumbersome. But now, we have a system with very few elements, which allows us to give courses today in Mallorca, tomorrow in Burgos, and Madrid the day after that. Practically speaking, this has been one of the biggest differences we have noticed. The ease with which it has allowed us to conduct a simulation, especially from the point of view of debriefing. Of course, the Codim database allows us to store all the simulations that we have carried out. The analysis process is easy, especially if you've got a good digital checklist which is standardized. Using the same checklist allows us to compare actions easily, and this has helped us a great deal. Apart from allowing us to do our simulation work, we've conducted research that will be used as part of a published thesis. We can also analyse what we're doing right and what we're doing wrong. Codim has allowed us to improve ourselves and change the courses that we give. We started off giving a series of courses in which, thanks to Codim, amongst other things, we began to see some deficiencies when it came to teaching and learning. This forced us to modify our approach to organising courses, our programmes and our way of teaching too. So, all in all, it's helped us to analyse the performance of our students, but also how we can improve the courses that we give.
Muchas gracias a toda la...
Hi there. First of all, thanks to everyone for being here, listening to me, and for the opportunity to share my point of view. My name is Jordi Bañeras. I'm a cardiologist specialising in cardiovascular critical care at the Vall d'Hebron University Hospital in Barcelona in Spain. I also have the honour and challenge of coordinating the Advanced Clinical Simulation Centre at our hospital. The Advanced Clinical Simulation Centre is integrated into the hospital itself, and obviously our aim is to improve patient safety and the quality of care. For this, we use different methodologies, both technical and non-technical skills, and a wide range of tools. We have physical spaces. We have low fidelity and high fidelity simulators. We even have a platform for online games that we call Simoons. Within all these strategies, the most important thing is a design which gives us favourable results for the objectives being pursued. And, of course, there is a tool which we are mostly talking about today. A tool which allows us to analyse recorded video in any of our centres. Codim. We've had some exploratory sessions with Codim, but we're still in the early stages and want to start exploiting it more. We know that it's important to be able to reflect on what has happened and use visual means to measure and evaluate. In other words, receiving feedback is essential in any activity that you want to carry out. At our centre, Codim is a tool which allows us to fulfil one of our major objectives, which is to reflect on, measure and analyse the results of the simulation. We've been experimenting with the tool from the beginning, and even after almost 3 years, we're still learning and finding out new things about the software. But we must, without a doubt, exploit the software in accordance with our objectives. What lies ahead of us? Here at Vall d'Hebron, we do different types of simulation, not only within the simulation centre itself, but also on-site at the hospital, where there are 9,000 professionals working. So, Codim is used not only in the physical simulation centre itself for the detailed analysis of our chosen performance indicators, but also outsourced to these off-site simulation events that we conduct in the care units themselves. Therefore, it covers our learning objectives everywhere in the hospital where simulations can be done. Dr. Marcos Pérez, assistant physician in the intensive care unit, is one of the doctors who has been most involved in video analysis with Codim since the beginning. He has even conducted a study researching and obtaining results with Codim on how we can design improvements to our next simulation program.
Yo soy Marcos Pérez, soy intensivista.
Hi there, my name is Marcos Pérez. I'm a critical care physician and I work within the simulation team at the Advanced Simulation Centre of the Vall d'Hebron Hospital. I'm part of the team that is dedicated to training both residents and tutors. I work alongside my colleague Daniel Lopez, who also works in the area of patient safety. We've tested Codim in both scenarios, with residents and tutors. Before this, there was an unknown factor which worried us, and that was the perception of the different facilitators who were conducting simulation events and the differences in how they evaluated them. With Codim, we were able to go through videos of different scenarios with a checklist of 5 essential elements of the scenario. For example, those related to hand hygiene. We then passed this digital checklist to all the different facilitators to use, and this allowed us to see the differences and similarities in how all of these facilitators did their evaluation. The results surprised us. Despite the fact that we would previously always meet with the facilitators to exchange views after the event and saw that all their views were similar, when we employed a systematic and statistical methodology through Codim, we realised that the similarities in perception were often quite low. This led us to taking action, incorporating debriefings with simulation instructors after each scenario. We also created much more exhaustive rubrics to ensure that the view of the instructor was not distorted in any way during the simulation scenario. We are now currently carrying out an evaluation of how effective these actions have been. One of the great virtues that we found with Codim is that it's like a Swiss Army knife. We can use it for the simplest of simulation scenarios right through to the extremely complex simulations at a multi-professional level. In both cases, we can incorporate the tagged clips into our debriefings and even analyse them again with all the different participants. This exponentially enriches the reflective thinking and conversations that we have with participants. In summary, we've used Codim in more than one aspect of research and applied it to evaluating simulation scenarios for both student and instructor performance. We've also presented this at national congresses, such as the CESAP and CESAM congresses in the latter part of 2022. There has been great interest from our colleagues, especially once they've seen the systematic and exhaustive methodology which has allowed us to carry out this type of assessment.
Bueno, buenas tardes a todos.
Hello, my name is Pier, Luigi, Ingrassia. Formerly, I studied anesthesiology, but after finishing my studies, I decided to dedicate myself to emergency healthcare. Specifically, emergency healthcare during disasters. Since then, I have worked in disaster health education, where, obviously, simulation is the only way to train I then became passionate about simulation in general and got involved with establishing a simulation centre at the University of Piedmont Oriental in Novara, where I was an associate professor.
Donde fue profesor asociado y hace 3 años.
3 years ago, I moved to Lugano, where I am now based, and where I am now the Director of Simulation at the Centre for Professional Healthcare in Lugano. I have different commitments, different tasks, at a national and international level. In particular, I am the Secretary of the European Simulation Society, SESAM, and the President of the Italian Simulation Society. At the Simulation Centre, our objectives are to conduct research on simulation and the use of simulation. Having the ability to film and having a digital checklist, a checklist which I can customise and develop depending on the objectives of my research, clearly favours the collection of data ranges in a way that is simple.
L'obiettivo di mi investigación claramente favorece la raccolta de datos en manera también fácil porque
in my opinion, more researchers can work using the same tool. And, in addition to research, it can also be used for training practice. Especially, in my opinion, for on-site training. I think it can be very useful in a clinical environment, because, obviously, in that environment, we don't have all the technology that is available in a simulation room or centre. We have the possibility of using an iPad to film each scenario and collect data at the same time. All of this simplifies my work and that of my colleagues in the centre. Digitalisation clearly diminishes the use of paper. All of us have to collect data. But more than this, collect it in a uniform and standard way. So the possibility of using digital tools favours us incredibly. With a few simple clicks, we can have the analysis more or less finished. Digital systems can offer us an instant analysis, or at least instant results. But, in addition to this, there is more and more talk about big data. About this incredible amount of data that we can collect and that can be used to aid investigations at a national and international level. As the pandemic has shown us, when we share this big data, the results are going to be faster and more precise. So that's it. I think digitalisation provides a great advantage in our professional environment. In simulation, most of the time, we base our knowledge on an experience, the simulated experience, which allows us to discuss, talk, reflect, and investigate. We can then film and analyse this experience live or at a
vez más vas a facilitar la vida del investigador.
Once again, this is going to make life easier for the researcher or debriefing instructor.
Y además,
Being able to precisely relate the data with the video, or specific moments of the video.
el dato con el vídeo o con un momento específico del vídeo o con diferentes momentos específicos en diferentes vídeos, creo que va a ser una
I think this is a great opportunity for everyone, especially for users.
Oportunidad para todos y sobre todo para los utilizadores.
Hola a todos, me llamo André. Barros.
Hello everyone. My name is André Barros. I'm from Brazil and I work at the Realistica Simulation Centre in São Camilo in São Paulo. Here we conduct courses in the healthcare area of the university. I currently act as the coordinator of the centre, where we carry out all the practical hospital and outpatient practice sessions. Codium has helped us a lot as a tool for creating checklists for the evaluation of our students during practical exercises. It has been used on medical courses mainly for protocol procedures, and at the university for the validation of emergency care skills. It is simple to use and great for testing the technical skills of our students. It's true that this is a very easy tool to use. Making digital checklists is a very simple process. Using the checklists to collect data is very easy for the instructors, for the technicians who are assisting, and also for the student. The process of feedback to students is great and shows them where they need to improve their performance. For me, I'm just getting started with this tool, which has great potential for evolving debriefings and for evaluating students. I believe that all simulation centres here in Brazil need a tool which allows them to evaluate students in a clear, objective way, and that makes a lot of sense during use. But, as I said previously, it's also a useful tool for handling the day-to-day tasks. It's very easy to use, easy to apply, and lightweight. Portability is extremely important as it makes it much easier to handle during practical tasks. We can also transfer it between our laboratories and classrooms with ease. Hello, my name is Edgar Quenta. I am the head of the Stomatology Simulation Centre at the University of Peru. My role is to direct the Simulation Centre, both academically and administratively, so that we can obtain tools that help us to better develop our teaching through simulation. The Simulation Centre has tactical, virtual reality simulators that provide exercises that can be implemented from the first year of a degree course through to the last. It can also be used at a postgraduate, master's and doctoral level for research purposes. The virtual reality equipment that we have has quite a wide range and allows us to design basic simulation exercises, even for students who have not yet taken anatomy. because it is aimed at students acquiring manual skills and abilities. Working in a patient's mouth is like doing a form of laparoscopy for the teacher, because otherwise the teacher would have to be in the patient's mouth in order to give the feedback or debriefing that is needed. The equipment in the simulation centre allows us to watch what is happening in the simulators in real time and see what the student is doing inside the patient's mouth. We couldn't do this in the clinic, as we would have to ask the student to leave the work area so that we can access the patient's intraoral space. So, we have a system in the debriefing room that is connected to the simulators so that we can see in real time what the student is doing in the patient's mouth using the virtual simulator. It helps us to implement strategies that allow us to integrate up to 3 or 4 videos. The first video is what the student is doing in the patient's mouth. This comes from the simulator, obviously, and in real time. Secondly, we have the objective evaluation, which also comes from the simulator. That is to say, how the student is really doing, the mistakes they make, and what they're doing well. So, the teacher has simultaneous 3D visibility of what is happening intraorally regarding ergonomics and biosafety. This is reported by the cameras that give us a student's perspective in terms of ergonomics and biosafety. So the teacher has to see all 3 cameras simultaneously. What Codim allows us to do is integrate these 3 video feeds together with a checklist or rubric that allows us to do the evaluation in real time. This pretty much automates the evaluation process, as well as the feedback and debriefing process. After the simulation session, which generally does not take more than an hour for virtual simulation, for the teacher to be able to link these 3 evaluations and feedback tools is complex. So, it helps us to have a system such as Codim which integrates all these sources of data together. Codim allows us to easily divide the videos into smaller clips using the digital checklist. This provides evidence of the student's performance over the course of an hour of simulation. Usually, evaluating an hour of video is complex, but if the teacher can simplify the process by using Codim, cutting the evidence down to minutes rather than a full hour, it is easier. It can show us the key points where the student is achieving the objectives of the session. So, this is very important for us. We can transform a 1-hour video into a series of 15 to 20 second clips that we can evaluate more easily. It's good for research purposes, academic purposes, and it allows us to give the student better feedback in a debriefing. Hello, my name is Edgar Herrera. I'm from Mexico City, and I'm currently the president of the Mexican Society for Simulation in Health Sciences. I've also worked as a teacher for several years at a private medical university, mainly in undergraduate simulation. Previously, we would film a video of the simulation session and review the full video later with the participants. This takes a really long time, having to search through the video for the exact moment where something of interest happened. Using Codim seemed complicated in the beginning, but once everything was set up and running, it was really nothing more than the instructor pressing a few buttons on a checklist on a tablet to grade and evaluate the work being done by the students. This tool has saved us a lot of work in this regard. We always get asked for in-depth feedback from participants in simulations. and previously this involved a lot of time and wasn't always possible due to time restrictions. This is why this tool has been so innovative for us. With Coding, we have all these videos separated by participant and use the same rubric to evaluate all the videos. Even though the instructor can't always be in the room personally with each participant, they can now give completely personalised feedback. Another innovation is that before there was a lot of work needed in terms of education and research to obtain all the necessary information from these activities. It would take 5 hours to plan a simulation, 2 hours to do it, 2 hours to debrief the participants, and then all the time needed for editing and analysing the video to get all the needed data. It would take 24 hours to get all the info from a 2-hour simulation. It was a long, heavy process. The first time we did it, we were very enthusiastic about the process, but subsequently, nobody wanted to do it. The advantage of using Coding is that, although we still have to do the planning stage, it helps us focus on what we want to investigate and the specifics of the simulation. And then, by just pressing a few buttons on the Coding template, we have the video, the results, and the exact data about what we want to investigate. So, instead of 24 hours it previously took us to evaluate a single activity, it now takes us no more than 4 hours. I believe that our objectives have been met, but we'll continue working on them to identify areas of opportunity. And not just areas of opportunity for our students, but also identifying opportunities where instructors can improve. Areas such as where the teacher's instructions may not be clear, or where we have to improve our own performance. It's been very useful for identifying areas where improvements can be made. Many times we see a teacher who is not bad at their job, but because they have been doing the same thing for several years without change, there may be areas of their practice which need to be worked on. This type of tool helps us to not emphasise errors, but rather make institutions see where improvements can be made. We're also seeing a lot of potential in broadening the scope of our educational research. Previously, there were very few people who wanted to partake in this, as it involved long hours of work to obtain very little data. But with Coding, we can obtain a lot of data in very little time, with little effort. So, I see a lot of potential in our use of Coding. Of course, just like any other tool, there's an initial setup period. But this will always exist, no matter what the educational tool being used. It's a process which, while I would not say is cumbersome or tedious, is still something we have to do manually. But once we have developed the rubric and put it in the system, once this is done, it's wonderful. We no longer have to waste paper, and it's extremely intuitive. Basically, if a teacher or student knows how to use a tablet or cell phone to send messages or send videos through the internet, they know how to use this tool. So, these are the great advantages we have seen. To sum up, apart from the first stage, the planning and adjustment period, Coding really helps us to obtain a lot of information in as short a time as possible.